you suffering from a bulging disc? Hi, I'm Dr. Norris Golberg, and I'm the owner here at Koru Chiropractic. And today I want to talk to you about your discs, whether it's a bulging disc, a herniated disc, or you're not even sure. Let's just chat a little bit. So we have discs or vertebral discs in between the bones, all the way from the lumbar spine where it joins with the sacrum, through the thoracic spine into the cervical spine until you get to the last one being at C2 and C3. So a couple of unique things about the spine. The thoracic spine, the discs are very skinny, they're very short. You rarely get a disc herniation here. The most common area for disc herniation is S1, L5, right here at the bottom of your spine, or just above at L4, L5. Or in the cervical spine, most commonly we see them at C5, C6, or at the adjacent levels C4, C5, or C6, C7, okay? So most commonly, I see a lot of patients coming in with these disc issues. That's something that I help people with on a regular basis. But exactly what happens is, as you can see, the jelly comes out of the donut, right? So what happens is that normally the donut, the outside at least, is like a hard car tire, and inside you have the jelly. Over time, the ligaments become less healthy, they start to dehydrate, and they can eventually tear. When they do tear, if they tear wide enough, the jelly will come out of the donut and it can touch a nerve, and that's when you really have a serious problem. Most people injure their discs at a pretty young age, usually in their 20s or 30s, and what happens is when you injure a disc at this age, you start to have a small tear at first, right? That small tear can be extremely painful. It actually creates an inflammatory effect within that part of your spine, and that can take 6 to 8 weeks just to settle that down by itself. The problem is you start having these tears and re-tearing. It's kind of like pulling off a scab. You do that about once a year on average, and eventually it gets to the point where, again, that jelly or the nucleus pulposus, the inside of the disc, actually comes out through the tear because it's now opened wide enough and it can actually put pressure on the nerve. If it's bad enough where it's really surrounding the nerve, eventually that type of case needs surgery. The good thing is, people who come to me with disc problems, probably about 90% of them are nowhere near needing spinal surgery at that point. One of the things that may affect the health of your disc is the alignment of your spine, right? So if your hips or pelvis are shifted or twisted to the side, or your neck is not in the normal curvature, it's kinked in the backwards position, that puts uneven stress on the discs. It creates abnormal wear and tear, and that's, in my opinion, what really leads to these tears or herniations to really start in the first place. Even if you've already had a tear, if we can correct the alignment, we can correct some of that wear and tear and potentially provide a lot more life and longevity to the health of that disc.